Maryland Live, Horseshoe, Ocean Downs, Rocky Gap, and Hollywood Casino are the state's 5 casinos, and while they are seen as sources of entertainment and money for the state, for some it leads to destruction. There are resources available for those suffering from gambling addiction. We're joined now by Lori Rugel. She is the program director for the University of Maryland Center for Excellence on Problem Gambling for Treatment and Research. Lori, it's a big problem, and we have these new casinos. Tell people, when people come for help, what kind of problems are they experiencing?
By the time they come for help, they're devastated. They owe tens of thousands or more money. They may have been evicted from their homes, from apartments. Families on the verge of leaving them. They may have lost jobs. They may have even embezzled or stolen money. I
think most people, when they think of what goes on at the casino, you think, oh, I've got a little bit of extra spending money and I might use that. Sure. And when I lose it, then I leave. But there is a segment of people who can't stop at that level, correct?
Absolutely. For some people, it's an addiction just like an addiction to alcohol or drugs. And it even has physical effects on people. And those are the folks we want to reach out to and provide help for and prevent those who can gamble for fun and recreation from ever developing a problem.
If people want help, can it be successful? Can they be prevented from having further gambling problems in the future?
Absolutely. That's the message that's really important. Treatment works. We know how to help people get out of their addiction and stay out of their addiction and really live rewarding, satisfying lives. So there is hope.
Yeah, I mentioned the 5 casinos open now. There's another one opening in PG County next year. They're going to be the largest one in the state. So as the level of casino gambling is ramped up in Maryland, are we seeing more addicts?
Well, Gamblers Anonymous meetings are growing. We're getting more and more helpline calls, so we have evidence that the problem is going. There's a self-exclusion where you can sign up and have yourself excluded from the casinos, and those numbers are growing, so the problem is growing.
If you are, say, a loved one, a wife or a husband, what should you do? What kind of signs can you look out for to see if there's problems?
Well, one thing to remember is we do have a helpline, 1-800-GAMBLER, easy to remember, so you can call 24/7, no charge, and get directed to resources for help. So if you see somebody becoming more and more preoccupied with gambling, more isolated, more secretive, you don't know where the money is going, their interaction with family members is changing. They don't want to attend family events, or they're giving up their usual activities. Those are all warning signs.
And the state takes most of the money that comes in from the casino. It doesn't go to the casino operators. The state takes the largest percentage of it. Is the state of Maryland doing enough to help people that are falling through the cracks with these problems here?
Well, I think the state of Maryland is doing a great deal. We have research on the impact of gambling, on risk factors for gambling. We're doing prevention in the schools and for young people. We have the helpline. We have a network of treatment providers that we've trained and are competent to deal with the problem. And we're doing even more, working with existing substance use and mental health problems and having them integrate problem gambling into what they do, and working really to remove as many obstacles to getting help as we can, including the financial ones.
It's just frightening when you hear people coming in with tens of thousands of dollars in debt based on a gambling addiction.
Well, for many, they see gambling as the solution because there's a little bit of truth to that. So it's not a problem, it's the way I'm going to solve all my problems, and that's a really difficult fantasy to break through.
Lori Rugel from the University of Maryland, thanks so much for coming in tonight.
Well, thank you very much.